Yes, we enjoy bringing you facts that you have to question, but we dig deep for those. All right, welcome back to Western New York Living. All right, how many of you know the exact name of the prescription medicine you might be taking right now? Do you know if it has any adverse reactions to other medicine you might take in the future? You probably don't, but your doctor will, and there's a very easy way to keep all of your medical records available to doctors, hospitals, and healthcare organizations. And join us this morning to tell us more about HEALTHeLINK is the Executive Director, Dan Parecka. Dan, good to see you.
Thank you. Great to be here.
For those not familiar with HEALTHeLINK, why don't you give us a brief description of what it is?
Well, thanks. We are the health information exchange that services the 8 counties of Western New York. Since our inception, our objective is to make sure that doctors have the information they need to better treat you as a patient, and that information can be from anywhere throughout the community and throughout the state, and frankly, across the nation now. We're getting to the point where the data can follow the patient wherever they go and seek treatment.
And this question might seem obvious, but why is it so important for doctors to have access to our medical information?
Well, if you rely on a patient's memory, that's if it's me, it's questionable whether I'll get it right.
Yeah.
No, it's critical. It's like any industry. The more knowledge, the more information that you have, the better decisions that can be made on your behalf.
Yeah, and also when you go in for an annual checkup, everything's right there. They can tell you what, hey, 2 years ago we did this. There's so much information provided the doctor to have a better experience, isn't it?
Exactly, and not only from your experience with that doctor, but a specialist, if you had to go to a hospital. So all that data gets aggregated and brought together and then can be presented to the doctor at the point of care.
Now, the patient has to consent. So how do they consent to or sign up for HEALTHeLINK?
Yeah, the consent, that's an important point, and I'm glad you brought that up. The key to unlocking that data is the consent form that a patient signs. And the good news is 85 to 90% of the adults in Western New York have already signed their consent form. So they can, and when they sign it, then any treating physician that they go to can then get access to that data. But we are, in New York State, we're an opt-in state, which means the patient has to explicitly opt in order to enable that data to be made available.
Do they have to bring it up to their physician, or can the physician ask them? Yeah. Can they nudge them? Can they hint? We're hinting on the show to sign up, but
Thank you.
Yes, can the medical provider hint?
It is generally embedded in the workflow of the practice. So at registration or at the hospital, they will typically ask at that time, because hopefully the patient has already signed one. So if there was some pre-visit planning, that was done, they would have had access to the complete record for the patient. But if not, then at the registration is typically when they would get asked. Another
key to this also is we're making it easier for the healthcare providers. Right. They've had a tough time here the last couple of years with the pandemic. So this may take some stress off of them trying to figure out, well, we don't know this or that. We can't get a hold of somebody. It's all right there. It's
all right there. And part of our challenge, and one of the things we're always looking at, is how can we make it more easily accessible within the workflow of the doctor and their staff, right? So how can we embed? So it's one thing to have them go out and log into the HEALTHeLINK application to look up the information, but it's another thing altogether, and better for them if we can push it into their electronic medical record.
Sure.
And we're doing that, and more application for that throughout the community.
This is a great service for healthcare providers and patients. Dan, thanks for joining us today. HEALTHeLINK's a collaboration among hospitals, physicians, health plans, and other healthcare providers in Western New York to securely exchange clinical information to improve the quality of healthcare for patients. To find out more, head to their website at WNYHealthyLink.com. Join the over 1 million people in our area using HEALTHeLINK today. Now, coming up next, getting whiter teeth can be done in as little as 7 days. Love Your Teeth will be joining us to talk about their easy 10-minute in-home application. Western New York Living will continue.
This segment of Western New York Living was sponsored by the following: